Welcome to CityWise. I'm your host, Tiana Stevens. CityWise is produced by the City of Rochester to shine a spotlight on city living at its best. That includes information to help keep you healthy and informed. Well, you're probably familiar with the American Heart Association's Go Red for Women movement. You've probably seen people wearing the color red or a little red dress pin during the month of February. But what you may not know is that heart disease is the #1 killer of women above all forms of all types of cancer combined. And that's the goal of Go Red for Women, to start a conversation about the seriousness of heart disease and to help save lives. Joining us now is Dr. Jon Bovi, board member of the American Heart Association and vice president of neuroscience at Unity Health. Also with us today is Kelly Johnson, a heart attack survivor, and she's here to share her story with us. Thank you both for joining us. Kelly, let's start with you. What is your experience with heart disease?
Well, 5 years ago, I had some mild symptoms that included tingling in my jaw and in my fingers. And then eventually it got to be a vague sense of nausea when I'd go up even just a few stairs. So we were on vacation in Atlanta visiting my in-laws, and my symptoms seemed to just be getting progressively worse. So I asked my father-in-law for a blood pressure cuff because I knew he had one in the house, and I measured my blood pressure. It wasn't tremendously high, but higher than usual. And just by me asking for the cuff, my father-in-law decided he was calling his doctor regardless of what I wanted to do. Mm-hmm. So we went to the hospital where they hooked me up to an EKG and transferred to another hospital where they did an emergency catheterization. And they saw that I had a 95% blockage of my critical LAD artery, and it required bypass surgery.
Okay, and you're part of the Go Red for Women movement locally. What does that mean for you, and how did you first get involved?
Well, after I had my heart attack, I wanted to do something to turn it into a positive experience, make something good from bad, and to learn something more about what I went through. So I called the Heart Association and asked if they needed any help in the office. And I've been going in ever since. And really you find out when something like this happens that you're not alone. And there are a lot of women out there who suffer from heart disease and you didn't even know. So it's very prevalent.
Okay. Dr. Jon Bovi, you often find that patients ignore their symptoms. What are some of the symptoms, and what is your advice about that?
Well, I think that women tend to ignore symptoms more than men do, and also in medical school, maybe not so much for people who are in medical school now, but the traditional teaching was heart disease was a disease of men, mm-hmm. and women don't usually get heart attacks. And we were taught the traditional symptoms, where you have the chest heaviness, shortness of breath, feel very sick and dizzy, and the symptoms come on fairly acutely. Even though men can have symptoms that are not that way, women are more prone to have vaguer symptoms, a vague sense of lightheadedness or nausea or the tingling, mm-hmm. or pain in an arm, particularly the left arm or the jaw, that aren't necessarily associated with heart attack. And then if they go to the emergency room, unless someone there is real keyed up to, oh, this could be a heart attack, particularly if you're a younger woman. If you're in your 40s or 50s, people may discount that and not take it as seriously.
Mm-hmm. We actually have a video to show. It's called Just a Little Heart Attack. It's produced by the Heart Association, as you know, and kind of highlights what you just mentioned. So let's take a look at that.
It's 4 o'clock in the morning. I was completely asleep, and I woke up with my heart going very fast.
I woke up and I could not move. There was, some pressure in my chest, some burning.
Next thing I know, I woke up in ICU.
And then I collapsed to the floor in front of at least 25 kids.
I knew the symptoms of a heart attack, but I never thought it was going to happen to me.
No. I'm not having a heart attack.
It's not me. I'm the nurse.
It was determined that my
heart muscle was barely pumping.
I call my girls and I say goodbye.
I was diagnosed with supraventricular tachycardia.
I had a massive stroke when I was 20 years old.
I had a heart attack.
I live with cardiomyopathy and ventricular tachycardia.
I was an attraction at the hospital. They went to come in and see the 31-year-old heart attack survivor.
Because I was so young, I didn't have the typical risk factors.
A lot of the doctors did not believe that I'm not a smoker.
I have a family history of high blood pressure. It was never something we talked about.
I come from a family of 8. Probably half of us have hypertension.
Other women that are athletic and lead a healthy lifestyle, they need to know that heart disease does not discriminate, with or without family history.
Things do get more stressful for women.
I don't have time to have a heart attack.
We feel guilty about taking care of ourselves.
It's really important that I have to take care of myself and not always worry about everybody else.
You have to put yourself first.
I was looking for answers.
I started looking for a support group.
And I clicked the Go Red for Women. I felt like it's not only me. There is a lot of ladies, they're going through the same thing I'm going through.
Over the course of about a year and a half, I lost 90 pounds.
I lost over 70 pounds now. I had a 3rd child.
Since my stroke, I've done 4 or 5Ks. On each 5K, I jump over the finish line. I'm so excited just to be walking again.
I sent an email and saying, please help me write my story because I have a story to tell.
There is a lot of work that's going into educating women about heart disease, and we need to. It's long overdue.
Me sharing my story is not about me.
I've shared my journey with many people. I want other women to experience it.
I fight for my life, and I fight for others so they don't have to go through what I did.
And that was some very powerful testimony. And one of the women featured in that video says 20 years old, she had an ordeal. What are some of the risk factors? Who does heart disease affect?
Well, risk factors for heart disease, and interestingly, the risk factors for heart disease and stroke, which is, if you want to think about it, it's like a heart attack, but it happens to your brain for the same reason. Blood supply can't get through a blocked artery and it affects your brain. Those risk factors are the same. And they include things like high blood pressure, high cholesterol, diabetes, being overweight, sedentary lifestyle. Certain other types of heart disease, heart rhythm problems, can increase your risk for stroke. A family history is often a big predictor. That's something we can't change. We can't pick our parents, but many of these other risk factors that I've listed for heart disease and stroke, we can do something to reduce our risk. We can control our blood pressure better. We can make sure that the cholesterol and lipids in our blood are within a reasonable range. If we have diabetes, we can get on a program to control our blood glucose better. And if we're overweight, we can change our diet and assume an exercise regime that will help with weight loss and increase our activity level.
Okay. And Kelly, after your heart attack, you probably made some immediate sort of lifestyle changes. How did that change your life? What are some of the changes that you made and are sticking with today?
Unfortunately, a lot of mine was family history because I did exercise before, and my diet was pretty moderate. So nothing has changed drastically, but I do eat more salmon now. I drink more red wine now, and I volunteer at the Heart Association.
Okay, wonderful. Dr. Jon Bovi, you have a mnemonic, well, the Heart Association does too, educate people on stroke, and it's called FAST. What does that mean? What does that stand for?
FAST stands for face, arm, speech, and time. And what it does is it illustrates the most common symptoms people would have if they're having a stroke. Drooping of their face on one side, trouble speaking, trouble using an arm, The T for time means that you have to call 911 right away. Don't call your physician. Don't wait thinking it's going to go away. Get to the hospital, because the treatments for stroke are very time sensitive. If you're not there within 3 hours, you are not eligible to receive the treatment that we now have for many types of acute stroke, which can reverse symptoms in some cases and prevent you from having a disabling condition to live with. In Rochester, in the Rochester area, no matter what hospital you pick here, only about 25% of people with stroke actually arrive in the emergency room on time to be eligible for this acute treatment. And if there's anything we can do to influence outcomes after stroke, is if we could get that percentage higher so more people could receive this treatment.
Okay, and you mentioned, listening to your body. There's another video we'd like to take a look at where it shows a busy mom who is kind of going through the morning and experiencing some symptoms. Let's take a look at that video.
It started out like a totally normal day.
Mom! Okay, move objection deadline to the third line after survey. Oh, honey, for when you write, always use the verb estar. What are you doing down there? Did you finish your breakfast? Ow. Whew. Don't hit your brother. Honey, you have to eat something. Here. Okay, 5 minutes to carpool. Where's my coffee?
You okay, Mom?
Oh, I'm fine. Sandwich orders. What do you want?
Almond butter and jelly.
Spaghetti.
Oh, you sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah. Here.
Acai, my favorite. See you guys later.
Where are your shoes? Put your shoes back on, please. Go help your sister. We're going in 3 minutes. Oh my God, what am I doing? I forgot to cut off the crust. Voila. Shoes on, potty if you need it. Honey, get your sister. Okay, here. Nobody move. I'm getting a dustpan.
Oh. Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? I'm just gonna sit down.
I'm totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards, Mom.
Come on, Mrs. Underdog is not gonna wait. Whoa. Okay. 9, 1, 1. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long? 2 minutes. Can you make it 10? I thought I had gas. Turns out I was having a heart attack. Heart disease is the #1 killer of American women. So now I take care of my heart and I tell the women in my life to do the same.
Sounds great, by the way.
That's nice, sweetie, but that's not my heart. That is. Make it your mission to save your life and the lives of the women you love. Find out more from the American Heart Association at goredforwomen.org.
Dr. Jon Bovi, the Go Red for Women movement encourages people to share that video, to talk about it online and with social media. How do you think that's helped the community, being able to have something that you could just click and share and communicate with other people? Or maybe, Kelly, you mentioned that there's a whole network of women out there. Talk about the support group here in Rochester locally.
I think it's really raised awareness overall. of heart disease and stroke. The American Stroke Association has been out there spreading their message, and I think that message too has also gotten back to providers in hospitals and emergency rooms to increase their awareness and to think when they get a woman with potential stroke-like symptoms or heart attack symptoms or even subtle symptoms, this is something that they need to think of. It's also increased the awareness of the men around us who, I know my husband, if I say I'm fine, he's going to say, okay, she's fine, and he'll just walk out the door. But increasing the awareness that we too are at risk for heart disease and stroke.
Okay. And Kelly, as far as the support network, what have you found at the local heart association that you'd like to share with us?
Well, they provide lots of information. I mean, if anyone ever has any questions, concerns, wants to learn more, the Heart Association is there for you. I think, I told my story online, and so it gave me the opportunity to see other women's stories and realize that, yes, I was young for this to happen, but I was not alone. So it's been very helpful to me.
Okay. Dr. Jon Bovi, how can people become a part of the Go Red for Women movement?
They can go to the American Heart Association website. It's very easy to access online and go to the Go Red for Women. That can show people in the community how they can become a part of this movement. There's a Go Red for Women Day, which is February 7th. Many of the businesses in the community are sponsoring competitions between departments to see who can wear the most red or is most creative with their Go Red attire for that day. And they can also go to the Heart Walk, which is going to be in April of this year, and participate in the Heart Walk. Also at the Heart Walk, there will be a number of booths from health providers and other people, and a lot of information about heart attack and stroke and reducing your risk factors. One other thing I'd like to mention, something that comes up very frequently, is smoking. And I'll be very blunt. If you have one of the other risk factors, hypertension, high cholesterol, or diabetes, and you smoke, you might as well be holding a gun to your head. I mean, that's a sentence that something bad's going to happen to you probably as early as in your 50s. And even smoking alone, if you don't have any of those risk factors, is going to significantly increase your risk for heart attack and stroke. Okay. And it's something that I know is difficult because cigarettes are very addicting. The nicotine is very addicting. It's even in some cases more addicting than some of the narcotic drugs you hear talked about. So it is not an easy thing to do. But there is support for that. There is help for quitting smoking. And if you smoke, please, quit for your sake and your family's sake.
It's definitely one of the risk factors that is in our control. Kelly mentioned heredity and how those things were out of her control. Are there other factors, race, ethnicity, that heart disease, that affect those groups disproportionately?
I think that the video actually illustrated that. If you watch the video, you realize that most of the women in that video, especially the younger ones, were either African American or Hispanic. And we do know that there is a higher incidence of heart disease and stroke in that population, and that it occurs earlier than it would in people of, let's say, of Northern European or European descent.
So what would you encourage women or men in those groups? What kind of conversation would you like to hear them have, like say at the dinner table?
I think people need to know their own health status, and we all need to take responsibility for managing that health status. So see your doctor. Depending on your age, you should see your doctor maybe once a year, maybe twice a year if you're older. Have your blood pressure checked. Know what that number is. Know what the normal range is. Blood pressure should generally be around 120/70. And we know that the higher your blood pressure is on a gradient, your risk goes up as the blood pressure goes up. So the lower you can get that blood pressure, the better you are. Find out, have your blood tested, find out if you have diabetes, find out if you have high cholesterol or high lipids. And if you do, not only just go to your doctors and get a prescription and say, okay, taking care of it. That might not be the final answer. It might be that you're not on enough to control your blood pressure, or you're not taking enough insulin to control your diabetes. You need to take ownership and recheck those numbers periodically to make sure that they're coming back to normal levels.
Mm-hmm. Okay, so Go Red for Women has been around, I think now it's in its 11th year. For you as a physician, what's changed over the years as far as research? What do we know now that maybe we didn't know before?
I think we have a better understanding of how heart disease affects women differently, how the symptoms might present differently, a better appreciation that this does happen to women, and that we need to know everything we can about the patient we treat. Even though we can't change your heredity, if I know that you have a family history of heart disease, even if it's been the men in the family, I still know that you might be at increased risk, and that increases my awareness. So our ability to put those risk factors together, to understand how they impact heart disease, and to really understand that it's a real problem in women.
Kelly, do you find yourself, sharing your story either with family members, obviously, but with friends as well as a way to get the message out?
Yes, definitely. When I came back after my surgery and would see friends, they said, "Boy, you really made us think about what we're eating, what we're doing for exercise, and things like that." So hopefully I've helped.
Well, the American Heart Association is also sponsoring a number of learning opportunities for people in the community. I know that they're working with some of the churches and the congregations in education about risk factors and controlling risk factors. They're also sponsoring a series where they will go to a business and do what's called a lunch and learn, so anyone at that business can learn about heart disease and stroke. And we're also working together with the Heart Association to find other opportunities where we can spread the word to everyone in this community about heart disease and stroke.
Okay. Specifically in your role at Unity Health, what is it that you do there related to stroke? Are you always pushing the word out, not just during February, but...
Definitely. We are now working to put together with the Heart Association, and we've hired a nurse that one of her roles is in patient education, and that's something we've really put increased emphasis on, because we've found out that many people, they have a stroke, they're in the hospital, it's a scary experience, they're confused. All those things that we tell them, and they're only in the hospital now for 3 to 4 days, we tell them all these things, and they get home and it's like, no, what really happened to me? What am I supposed to be doing? What am I supposed to be taking? Don't remember. So we see every patient who's had a stroke within 7 days of that hospital discharge. Our nurse meets with them, goes over their specific risk factors, what they need to do, where they're at. They see our stroke neurologist in the outpatient clinic, and all of that is to ensure that they stay on their medications, they know what those numbers need to be, and they understand the importance of it. And if you look at research that's been done, when programs have been put in place that follow up that hospitalization with a visit very quickly afterwards, the outcomes are better, patients are more likely to continue to take medications and make lifestyle changes that they need to.
And do you find that your patients are pretty compliant with those follow-up appointments?
Well, most of them are. We now have gotten so that we are seeing about 80% of the patients. We are able to schedule about 95%, and of that 95%, about 80% are actually showing for the visits. And now that we have this nurse involved, if you don't show up for your visit, you get a phone call. Hi, Mr. Smith, why didn't you come in to see Dr. Burke, the neurologist, today? Sure. Can we make another appointment for you? Can we arrange transportation for you if that's a problem? Because sometimes that's a problem for elderly patients, especially if both are disabled or one has a disability, is transportation. So we're kind of taking steps to improve that.
Thank you. Well, thank you ladies both very much. Kelly, thank you for sharing your story.
You're welcome.
Again, to learn more about cardiovascular diseases, you can visit goredforwomen.org. You can also call 1-888-MY-HEART. Thank you for joining us on this edition of CityWise. I'm Tiana Stevens, and we'll see you next week.